Emma, so what are we expecting from China? Because we know that transparency with these numbers is not really a done deal in the country.
Yeah, that's right. So it is interesting that they have come out with this 60,000 number. It does suggest that they are recognising the pressure that they are getting, particularly from international bodies like the World Health Organization, from the US in particular, around their COVID data, which has basically been either non-existent or meaningless for the past month. That said, the number they have put out has immediately raised questions. When you're talking about 30 million new cases a day, which is what the government was talking internally about a couple of weeks ago, 60,000 cases a day is not a huge number and is well below some of the modelling that the likes of Barclays and others have done on the amount of deaths that are actually occurring in China. So lots of questions there.
Emma, and the details about the types of people that have suffered fatalities kind of fits in with the broader narrative about how COVID is not dangerous to the broader population, right? These are elderly people, and most of them, in fact, an overwhelming majority of them have these comorbidities.
Yeah, I mean, I don't think that's a surprise given what we have seen when it comes to COVID fatalities elsewhere in the world, that most of these deaths that they're owning to are in over 80s, particularly when you think about how low comparatively China's vaccination and booster rate is when it comes to COVID vaccines. It's not a huge surprise that you would be seeing a lot of these people a lot of these fatalities being in that age group. And that is what we're hearing from our reporting on the ground, with the overwhelmed crematoriums, with people who can't get a slot for their elderly parents, and how they're being told they didn't die from COVID even though they were infected with it, but from these other comorbidities, as you mentioned.